Welcome to Neuroanatomy. In this video, we'll explore the gross structure of the spinal cord, its extent, coverings, internal features, and clinical relevance. The spinal cord is a cylindrical structure, continuous above with the medulla oblongata, and lies protected within the vertebral canal. Like the brain, it's surrounded by meninges and bathed in cerebrospinal fluid. The spinal cord extends from the upper border of the first cervical vertebra to the lower border of L1 in adults, and to L3 in newborns. It tapers below into the conus medullaris, which continues as the filum terminal anchoring it to the coccyx. Remember the mnemonic, C1 to L1, cord is done. The spinal cord is about 45 cm long in males and slightly shorter in females. It has two enlargements: the cervical enlargement for upper limb innervation and the lumbosacral enlargement for lower limb innervation. Externally, the spinal cord shows several longitudinal grooves. The anterior median fissure is deep, while the posterior median sulcus is shallow. The anterolateral and posterolateral sulci mark the entry and exit points of nerve rootlets. The spinal cord is divided into 31 segments, each giving rise to a pair of spinal nerves: 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Use the classic mnemonic: breakfast at 8, lunch at 12, dinner at 5, 5, and 1. Each spinal nerve arises from a dorsal sensory root and a ventral motor root. Below the level of the conus medullaris, the nerve roots descend in a bundle called the cauda equina, resembling a horse's tail. On cross-section, the spinal cord shows an H-shaped central gray matter surrounded by white matter. The central canal runs longitudinally through the middle, containing cerebrospinal fluid. The gray matter is made up of neuronal cell bodies and is divided into anterior, posterior, and lateral horns. The anterior horn contains motor neurons, the posterior horn receives sensory input, and the lateral horn, present in thoracolumbar segments, houses autonomic neurons. Mnemonic: A for action, P for perception. The white matter consists of myelinated fibers organized into tracts. Ascending tracts carry sensory information, while descending tracts carry motor commands. These fibers are grouped into anterior, lateral, and posterior funiculi. The spinal cord receives blood mainly from 1 anterior and 2 posterior spinal arteries, reinforced by radicular arteries such as the great artery of Adamkiewicz in the lower thoracic region. The spinal meninges, dura, arachnoid, and pia, surround the cord, forming protective spaces. The epidural space contains fat and venous plexuses, the subdural is a potential space, and the subarachnoid space contains cerebrospinal fluid. Clinically, lumbar puncture is performed below L3 to avoid cord injury. Damage to the spinal cord can result in paraplegia or quadriplegia, depending on the level. In poliomyelitis, the anterior horn motor neurons are selectively destroyed. To summarize, the spinal cord extends from C1 to L1, divided into 31 segments giving rise to 31 pairs of spinal nerves. Its gray matter forms an H shape and controls motor and sensory functions. The cord is nourished by anterior and posterior spinal arteries and protected by meninges and CSF. Hey docs, that's all for the day. Thanks for watching the video. I hope you enjoyed it. If you enjoyed it, please hit the like button, comment down, and subscribe for more such videos.